In his remark, Chairman on the occasion, Dr. Felix Yamu, commended the President and founder, Ame Healthcare and Empowerment Foundation, for deeming it necessary to alleviate the suffering of the people, especially women, by providing free eye care and cervical cancer screening.
The purpose of this Ame Healthcare Foundation screening is to detect it early, so that those persons who ordinarily would have had worst cases, once you discover them early, you can apply treatment, and in the long run, they will be saved.
The President, Ame Healthcare and Empowerment Foundation Chief Rita Amiwu Oguntoyibo, said the free eye check and cervical cancer screening exercise was organized to mark the 50th memorial of her late father, Chief Josiah Eyosun Amiwu. She said her father was passionate and concerned about the health and the welfare of people when he was alive. Hence, his passion is being kept alive through the program.
For the 50th memorial of my father, I needed to put up some activities on health program. And so we are having this outreach for eye care to distribute glasses and to screen breast and cervical cancer to mark his 50th year of leaving us, to say that we have not forgotten him, that his legacies remain with us, and that we miss him so much. And this is why I put this together along with other members of my family.
What she's done here captures what the remembrance ceremony of my dad is all about, because that's one of the traits of my father, which cascaded down to the children, especially herself, and she's doing it.
Dignitaries at the event, who include former First Lady of Edo State, Mrs. Eki Igbinedion, and others, said the foundation has impacted the lives of many within and outside the state.
Chief Mrs. Rita Amiwu Oguntoyibo has been in this for many years, and we know her, we have recognized her, so we are all here to support her. Any good cause should be supported. So we're here to give her full support and to encourage her to do more, and also to appeal to good people out there to emulate such a wonderful example of giving back to society.
A man that raised a daughter like this needs to be celebrated, and there is no other way than celebrating this great man that brought this daughter to us in Benin Kingdom.
The area she's tackling is to alleviate the suffering of the people.
Over 100 persons, including the elderly, benefited from the free eye screening, collection of glasses, breast and cervical cancer screening, and treatment of precancerous cells with cryotherapy.
She has been doing this thing for us for years. I want God to bless her.
She has really done well by giving glasses to everybody, free of charge.
Roslyn Eworame reporting.
If people go to the prayer, follow them. It's not picking.
Chief Josiah and your son, eye care. Healthcare empowerment.
Yes. Thank you. Sorry, I can't leave here. No problem.
Okay, can I check?
We've been in this business for some time now. Oftentimes we have organized outreaches like this, giving out free. Okay. We have given out free classes to many. We put on record that it was Ame Healthcare Foundation that set up the cancer screening, cervical cancer screening in Edo State Hospital Management Board. Not only did we set up the place, we also provided them with the equipment, and we have also been giving support. At the time, we also provided materials and drugs in UBTH for those with cataract so that they can have free surgery. We are collaborating with UBTH and we are using their centers and their personnel. Sadly, that one is on hold for now, but we are hoping that we will reactivate it. Today, we are just organizing this to honor the passing of Chief Josiah Amiwu, and we are glad that so many persons have turned out. We are hoping that at the end of the program, so many will be touched, many classes will be given away. Even while sitting here, I have had a whisper that even as they are screening, they have found some positive cases of cervical cancer. As a doctor, let me just say briefly about cervical cancer. Cancer generally, the cure to it or the secret of surviving any cancer is early detection. Any cancer that is detected early and appropriate treatment given can easily be mitigated. However, most persons present late. So the purpose of this Ame Healthcare Foundation screening is to detect it early so that those persons who ordinarily would have had worst cases, once you discover them early, you can apply treatment and in the long run, they will be saved. And we would strongly advise any woman less more than 40 years in this gathering today, do not go without going for screening. Because when it is just starting, it will just be like a small lesion. With our screening, we are able to detect it, and we have equipment that can also treat it at that early stage. Even those that are having cases that are already getting advanced, we also have program for them. We are in touch with UBTH. Professor Okonkwo has been working with us, and we are sure we'll be able to provide some relief. I want to encourage all of us to take advantage of this. I want to especially thank the president for deeming it fit to bring this thing to his people in Benin City. She's actually not based in Benin, but over time she has always wanted to bring things to people in Benin because she was raised here, her father was a chief here, and she has always felt that she owes us something. We want to thank you especially, madam. We pray that the Lord will replenish your forces. For those of us who are here present, Ame Foundation for now is surviving solely on the support of the Amiwu family. We feel donations from individuals. So I want to encourage us, those who love good things, we can still donate to the Ame Healthcare Foundation. As you do so, God will bless you. You are all welcome.
Women Healthcare and Empowerment Foundation. Please, can you stand up for recognition? Can we come out? Can we please? Yes, we still have more coming out. More coming out. We recognize you and we thank you. Thank you. Thank you. We can go back to the seats. Thank you. Next, we're going to be having
To Benin City in particular is one of the ways that she has shown that she truly loves us in this state. My dear sister, I want to congratulate you and I want to thank you for this great thing that you have done today. Honorable members, distinguished ladies and gentlemen, caregivers who are here, I thank you for coming out, lending your support to Ame Foundation. Members of the press, our dear friends, and family members of Aimiwo family. First of all, I just want to thank God for this very special day. What is happening today, as Dr. Iyamu has rightly said, is something of great significance, something we must all take advantage of. Ame Foundation has done so much in the past, but today is a very unique day. Cervical cancer screening is going on right now as we speak, and we want to encourage women to go out there, register and be tested, because if it is caught early, it can be dealt with easily. Secondly, we have eye care here as well. I have seen a lot of free glasses that would be given to people today. I want to encourage you to participate. Come out and get the necessary medical attention that you require. Again, I want to thank the President for bringing this to Edo State. She has gone to many states. Her work is going on right now. Ame Foundation work is in Gombe State. They are in Osun State. They have been to so many other states doing this work. This is a non-governmental organization. It is not government program totally, but of course in collaboration with several state governments to ensure that their people, good health is brought to their people. So I welcome everybody here. It's not a speech-making day, but it's a day to commend what is good. And my dear sister, Chief Mrs. Rita Aimiwu Oguntoyibo, I want to commend you. And I want to appeal to the public that if you have this in you, please come out with it and do it in order to benefit the good people of our country, Nigeria. With many more people doing non-governmental work, we know that this country will be a better place for all of us. Again, I want to thank you, ladies and gentlemen, for this attention you have given to listening to this voice. I pray that everything we do today will be very successful in Jesus' name. Thank you again. God bless you all.
Dr. Felix Iyam. A round of applause for Uliha of Benin Kingdom.
That is complementing the effort of the state government. Is something a lot of organizations to emulate, because a very healthy society is a wealthy society. See, the foundation is a foundation that the state government to support. If the state government should support this program, it will go a long way to alleviating the suffering of the masses. This foundation is, I don't have much to say as at now, but it is a foundation that should be embraced by all. Thank you.
Of the dignitaries here who have honored us with their presence, we're deeply grateful. I'd like to start with the representative of the Commissioner for Health and the PS for the Hospital Management Board, Dr. Sayende. Thank you very much for your patience. I'd like to also recognize our host, our very amiable host, the former First Lady of Edo State, Mrs. Eki Binedion. I'd like to thank my dear brother who has come all the way for this speech. That AME Foundation has been in existence since 2004, when I got the vision to do something, and though I wasn't sure at first, but it became clearer, and that was how AME Foundation started in 2004, and we have evolved over the years, as you have heard by members of the board. We're not only, even though we started in Edo State because charity should start at home, but we have moved on to support other states across the country. We have been to support Kano, Lagos, Delta, Cross Rivers, Osun, and we've done a lot. We are still in Gombe and Osun State doing a lot of work. And I want to say that because my parents are from this place, and so I'm a daughter of the soil, I have chosen Edo State as a place where we will continue to have AME Foundation activities. This particular one is to commemorate the 50th memorial of our dear father, Chief Yosu Josiah Aimiwu. And I want to declare that by the grace of God, we will do this every year going forward. has been mentioned, AME Foundation has been working in the areas of eye care, in the areas of cancer control, and we provide skills empowerment because we recognize from the very first day that poverty and ill health are siblings. And if you don't believe me, go and find out. There are people who just wait to die at home because they are poor and have no resources to access medical care. And so that informed the need for us to include empowerment. And I hope that very soon we will continue the empowerment program we started in Edo State. But I want to tell you that we're doing a lot in Gombe State, where we have 3 different empowerment programs. We have programs for those that are blind or partially blind from onchocerciasis. We're training them to do soap, cream, beads, twine, mattress, local mattress, and pillows. And we give them materials to continue to work. The second skills we have is for those that are impacted by lymphatic filariasis. You know, when people suffer from severe condition of hydrocele and they are not able to move around and they lose all the resources they have in trying to find cure. And then for those with elephantiasis who grow, their legs become so huge that they are not able to move around. When we eventually give them care, they are now set to come back to the society. So we train them on skills to do different meals, soups, efori rope, bolo soup, egusi soup, afang soup, white soup, jollof rice, fried rice, chicken sauce, fish sauce, egg sauce, and pastries. We teach them to do cakes, meat pies, fish rolls, cinnamon rolls, chapman, zobo, and other drinks. And the third category is the general public that we train to do liquid and tablet soap, sanitizer, perfume, body cream, hair cream, detergent, Izal, and so forth. I hope that very soon we'll be able to cascade that to Edo State. And we are also in Osun State, providing care for people, basically the neglected tropical diseases, in both Gombe and Osun State, where we distribute medicines in every household across the state to prevent onchocerciasis, lymphatic filariasis, schistosomiasis, and soil-transmitted diseases. And I want to say that I am particularly delighted that we are able to do this on this occasion, and I hope that a lot of people will take advantage of this and come to benefit. We are here today and tomorrow, and I want to again take this opportunity to thank those who have come all the way. I appreciate you. I thank you all, our dear Father. God bless you, sir. I thank you all so much. Thank you all. I know that my sister, Excellency, said I will be in Benin for this. Thank you so much, my sister, for your flinching support. And the chairman of the board had to change his program at a very high cost and had to fly in early this morning from Lagos. Thank you so much, my chair. Finally, I want to thank my foundation team, particularly matrons Odine and Oyiboke. Please stand up. These two women have been with our foundation since 2007 when we started the outreach, And in 2008, they were the pioneer team among 78 doctors and nurses that was trained for Edo State. Number of centers in Edo State, so say that we have the equipment that can screen the breast, and you can actually see everything in the breast. So if there is any question mark, we can see it with the open eyes, and you as the client can see that we are using it right now during this screening. Thank you all so much. Thank you again and again. Thank you, thank you, thank you.
A round of applause for him.
Nice what he did. He has a legacy. And we are very, very pleased and happy that you all can come here today to grace the occasion. It shows the love you have for those organizing it. And it shows the passion you have for what AME Foundation is also doing. So thank you. First of all, I just want to start by acknowledging my sister. I'm so proud of her as a sister. I don't recognize her as Chief Rita. I say, well, she's just my sister. And that is enough for me. Rita didn't start today being philanthropic. She's always been this way since when we were young. She goes out, she's meticulous, she's articulate, she does things that she wants to do, and she pursues it to the very end. She's always been somebody who has everybody's interest at heart, and she does all she can to make sure it happens, even at her own expense. So I'm not surprised she started AME Foundation, and I know it's going to grow from strength to strength, and I pray it does. You have worked very hard, you have earned all the accolades that come to you, and I pray to God you continue earning it. In Jesus' name. Now, of course, this is the first of a number of events we'll be doing to commemorate the death of my father. We have another one tomorrow here, another outreach, which Rita has eloquently put to everybody what she does. On Saturday, we're going to have the unveiling of the mausoleum. I know Father Chukwulea will be there, and other family members, and of course, our friends and family, including Her Excellency. Her Excellency will also be there to honor us with her presence and grace the occasion. And I'm hoping that some of you will come. Probably Rita has told you. It will be an honor for you all to be there. So again, I wish to extend my thanks to AME Foundation, especially the caregivers. I hope that your presence in Edo State will continue to increase and expand, and you work more closely with the officials to provide the service and actually expand it so it benefits the people of the state, because we do need it. I've always believed that we don't expect the government to do everything for us. You must have other people contributing towards it, and that's how it really works. It's collaborative. So I hope everything goes very well today. Everybody, just make sure you avail yourself to the opportunity you have here. Do your eye screening, your cervical cancer screening, and everything that is there. Okay, and have a very nice day. So thank you, everybody. Please have a nice day.
Thank you very much, sir.
Permit me to recognize in no particular order certain persons on the high table. And let me state ab initio that I'm wearing oversized shoes because I'm representing both the Commissioner for Health and the Permanent Secretary of Hospitals Management Board or agency. It is interesting to note that this foundation has been on for 18 years, and this is the second outreach program for Edo State.
No, for my father's family.
Okay, all right. Thank you very much for that correction. And I understand you also operate beyond the state, as far as Gombe State. Healthcare is capital intensive, and presently government operates healthcare as a social service, which means it's not supposed to be profit driven. And you know that investment in healthcare is not something small. to buy medical equipment, for instance. Medical equipments are much more expensive than any other equipment you can think of. And yet government is supposed to run it as a social service, not profit driven. Therefore, it is become necessary that people should collaborate with government at one stage or the other, because government alone cannot possibly meet the health needs of everyone. There are a lot of underserved people in our community for whatever reason. So anytime we have anybody coming to collaborate with government one way or the other, we are always excited about it, and they are always welcome. So it's on that note, I want to particularly thank the AME Foundation for what they are doing today. It's highly commendable. And we will also use the same opportunity to appeal to other philanthropic individuals and organizations to help reach out to our underserved people. There are so many of them in our community, one way or the other. Because I particularly observed that anytime there's an outreach program like this for free services, the place is always packed, which means it's a true testament to the fact that there are a lot of people who need medical services but cannot access it for one reason or the other. So that is why this program is very laudable. And we are appealing to all other individuals, organizations who have such drive to participate, partner with government one way or the other, so that we can boost the health of our people in Edo State. So on behalf of my Commissioner for Health, the Permanent Secretary, I want to officially flag off this outreach event, knowing fully well, like God told us that whatever you do to the least of my brothers, that you do unto me. So it's on that note I flag this ceremony open. Thank you very much.
Thank you very much, sir. A round of applause just before the point by the President.
Our joy today by her presence, and that's our excellence. Thank you very much. We started this journey many years ago. The President and the founder of the foundation about the need to help our women. In fact, that endeared me to her. Just like the brother said, she is a very compassionate person, very detailed. She goes to the last letter to ensure that somebody's tears is wiped away. And that is what we are seeing today. So I want to say a big thank you. I just felt that I must stand up on this auspicious occasion to say a big thank you to you. On behalf of the women in Edo State, I want to say we are very proud of you. The only thing we owe you is a lot of prayers that God will give you long life to continue this wonderful work we are doing. And you will carry it to the whole of our continent, Africa. To see that a black woman is coming out to this fashion to help the less privileged women, to help our mothers, to help. I want to, on behalf of every woman here present, say a big thank you. Please, can we all clap for this woman? Can we all clap for this noble woman? Please stand up, let us give her a standing ovation, because we don't have two of our kindness for her. Please stand up and just give her this ovation. Money cannot thank you for.
Please come over, come and hear all the accolades, all the chieftaincy. They want to give her that chieftaincy title. They are all celebrating her. Thank God you are alive, people are celebrating her. Before I sit down, I want to say one thing. Stand up. Great women on the move! Great women on the move! Great women! You train a woman, you train a nation! No woman, no nation! Women talk to women, women understand! We
line up. But lastly, I would like to have a quick photo. And we have a banner out there, which I think outreach.
Like I said, it's a very special day for the people of this state. I'm very happy that AME Foundation has come back to Edo State to help our people, to help the less privileged, to bring health care to Edo State. They have been in the field of providing health services. AME Healthcare Foundation is very well established non-governmental organization that we have known for many years. Today they are here to carry out an outreach for cervical cancer screening, for eye care. They are giving free glasses to people. They are basically bringing healthcare to our people, and I'm very happy. And we are here to identify with a very good cause. Chief Mrs. Rita Aimiwo Oguntoyibo has been in this for many years, and we know her, we have recognized her, so we are all here to support her. Any good cause should be supported. So we're here to give her full support and to encourage her to do more. And also to appeal to good people out there to emulate such a wonderful example of giving back to society.
Thank you, ma'am.
You're welcome.
Yes, it's quite a laudable program she's running. And it takes generosity to go on with a foundation of this nature. If you are not generous, you cannot sustain, you cannot actually create an impact that will affect a lot of people in the society. And this is the time of our lives we need people of this nature that will come up with this health outreach. If you observe, a lot of diseases are increasing on daily basis, and the area she's tackling is an area that is most essential, and is an area that actually affects the masses. So for such a person to come up, is to alleviate the suffering of the people, because like this very cancer screening is an expensive screening, and she's beating it down and is creating a forum whereby even the poor masses can afford it. So a person that has been able to come up with such an initiative needs to be commended. It's quite a commendable effort. Thank you very much. I'm Chief Oleha Adiole of Benin.
I want to say a big thank you to AME Foundation, the founder and the president of AME Foundation, Chief Mrs. Rita Oguntoyibo, near Amiwo. She's been a wonderful woman in Edo State, a woman that every woman should appreciate. I really appreciate her for her kindness. She's been so consistent in bringing this to her people. Though she goes to other states, but she remembers that charity begins at home. And seeing today as a very remarkable day where they are marking the 50th remembrance of their great father. A man that raised a daughter like this needs to be celebrated. And there is no other way than celebrating this great man that brought this daughter to us in Benin Kingdom. That is Mrs. Rita Oguntoyibo. She's doing this and remembering the less privileged in the society who perhaps cannot access or discover blindness on time and cancer. And she goes further to give free cataract surgery to those that cannot afford. And in doing that, she provides food even during the exercise. How many people can do that? In fact, I really appreciate her. My advice to her is that she should continue with this good work. And because she's from Edo State, she's from Benin, I want to appeal to her to open a center where women can walk in freely and do this free eye test and have their cervical cancer test, so that our women will see Edo State as a place that is free from all women to have any cancer-related disease in the area of cervical cancer. So I want to appeal to her to open a free center, collaborating with other states, and they are all appreciating her. She should come and drop a seed back in Benin so that our women will be there. And I'm using this opportunity to call all women out to come and use this opportunity to go through this test and be sure that they are free of cancer, because early detection will save your life.
Thank you, ma'am.
Thank you very much.
Advice for Rita? I don't think Rita... yeah, the family put it together, but again, I think Rita has been the driver, in actually making things happen. You talked about giving Rita advice. I've known Rita all my life. She's my sister. So as I said during the speech I made, I'm not really surprised at what she did, because she's had those characteristics, those traits of compassion, of actually reaching out to people and supporting people and making things happen. And when she puts her mind to something, she does it, because she's very meticulous and very strategic in what she does. So I'm not surprised she's walking across all the states. It's just normal. That's her nature. You don't learn it, you are it. So setting up a foundation, which she did, and reaching out to people who really wanted and working with government is a compassion she has, because she's putting something back into society. And I look at the crowd there, and some people will be saved. You had the medical director say that they're doing cervical smears and you're finding women with traces of cancer. That kills. If it's gotten early, it is dealt with, and then you are okay. So that's actually saving lives. And that's the kind of satisfaction I think she gets. Saying, I did something worthwhile. It's not giving people money that matters, or having parties, or being nice to people. Actually empowering people. Not only saving, but also empowering. And I think what she's done here captures what the remembrance ceremony of my dad is all about. Because that's one of the traits of my father, which cascaded down to the children, especially herself, and she's doing it. My father was also compassionate. He reached out to his family, to the general public, and that's why all these chiefs are here. People he's known a long time ago. My father died 50 years ago, yet he's still able to move people to come to a remembrance ceremony. So that shows the association he had with them. And that's a great thing. And that's the compassion Rita also has, which is, going to other people. So I'm happy. I don't call her chief, as I said. I just say, that's my Rita. That's my sister. I'm extremely proud of her, of what she's done. And I just wish she goes on from strength to strength and achieve more as she progresses. Okay?
Thank you, sir.
Thank you.
Well, first, as you've heard, AME Foundation started 18 years ago in 2004, when I clocked 20 years in the service of WHO, and I realized that I needed to give back. And I think part of the reasons I was giving back is because I knew where I was coming from, and I knew that even though my father died when I was 16, God had stood by me and taken me to the height where I am today, and I just wanted to do something for people in return. And so now that AME Foundation, by the way, is named after my mother, Amenango, and I just thought that for the 50th memorial of my father, I needed to put up some activities on health program. And so we are having this outreach for eye care, to distribute glasses and to screen breast and cervical cancer. And so we're going to be having this today and tomorrow. And of course, as you know, the grand finale is the unveiling of the mausoleum for my father and the reception thereafter. So this was put together to mark his 50th year of leaving us, to say that we have not forgotten him, that his legacies remain with us, and that we miss him so much, and that one thing he stood for charity. And so giving to people is one thing I think he would love, and this is why I put this together along with other members of my family.
Thank you, ma'am.
Thank you.
Yes. I pray that God will bless her so much, because she has really done well by giving glasses to everybody free of charge. We thank God for her life, and we pray that God will continue to bless her for the good work she's doing. Maris Ego.
Move on. From here.
For the person who bring us to this place today, God will bless him and bless the children. I thank God of Almighty. We have been doing this thing for us for years. Today he do it for us again. I want God to bless him and help him and provide more for him to be helping us every time, anytime. Thank you, Jesus. I'm Mrs. Philo Umahole. Yeah, thank you.